is Nia Lane, and I will be talking to you guys about birth control. What is birth control? Birth control is the practice of preventing unwanted pregnancies, especially by the use of contraception. There is more than one type of birth control, and these types include an IUD, spermicide, pills, depot shots, vaginal ring, male contraceptives, diaphragm, cervical cap, a female condom, birth control sponge, birth control patch, a vasectomy, a tubal ligation, a birth control implant, and abstinence. I will only be discussing a few methods of birth control in these slides, and the ones that I will be discussing tend to be the most common. Now, I will talk about a few facts with birth control. According to DoSomething.org, the first type of birth control dates back to 1550 BC in Egyptian manuscript. Birth control is 99% effective if used correctly. You do not need a prescription for every method of birth control. Some are over the counter. Birth control also results in a controlled birth rate. The leading birth control method used by women ages 15 to 29 is the birth control pill. Birth control is a multi-billion-dollar business, which means it is expected to grow and provide more effective contraceptive methods in the future. With that being said, I feel as if it is interesting to know that scientists and doctors are also working on male forms of birth control. It is important to think about your health prior to getting on birth control. So, if you tend to have any of these problems, birth control may not be the best option for you, or you will have to talk to your doctor about which method is the best for you. These problems will occur if you use certain types of birth control. Sore breasts, endometrial cancer, unexplained vaginal bleeding, liver tumors or liver disease, a blood clot increase. Also, if you are pregnant, do not use any forms of birth control. It can harm you and your baby. Now, I will discuss more negative effects of birth control. These negative side effects of birth control include breakthrough bleeding or spotting, possible weight gain, mood swings, and even nausea. There are also more severe risks of birth control that are different than the ones that I stated previously. These severe risks include blurred vision, severe stomach pain, swelling in the legs, chest pain, heart attack, and blood clots. Positive side effects dealing with birth control. Birth control can ultimately reduce acne. It can also help prevent some sort of cancers. It helps with less cramping. It also helps with a lighter flow or shorter flow. Knowing some people that have been on birth control, I know that birth control really depends on your body. Some people who have side effects that are on birth control, they do not always tend to happen to everyone. There are some people I know that are on the depot shot and it rejected their body and they are having bad side effects such as heavy bleeding, continuous stomach pains. And there are also people that I know on the depot shot and it works just fine for them. On the next slide, I will go into details about some forms of the most common birth control. The first birth control that I will be talking about in a more depth manner is the IUD. An IUD is a T-shaped plastic contraceptive that is inserted in your uterus. This method is 99.9% effective. An IUD is inserted through an applicator tube. I have heard a lot of mixed reviews about people who are on the IUD contraceptive. Some people have issues with the contraceptive actually staying in their uterus. I've known for it to travel and go into more places in your body, and that's not necessarily a horrible thing, but it can cause later problems down the line. The next contraceptive that I will be talking about is the birth control pill. The pill contraceptive is 91% effective. You typically take birth control pills daily at the same time in order for it to actually do its job. This pill contains two hormones, which is estrogen and progestin. I was on birth control once, and I was a person that took the pills, and personally, the pills did not work out with me. They help with certain things, but they also cause problems in other areas. The next contraceptive that I will be talking about is the birth control pill. The pill contraceptive is 91% effective. You typically take birth control pills daily at the same time in order for it to actually do its job. This pill contains two hormones, which is estrogen and progestin. I was on birth control once, and I was a person that took the pills, and personally, the pills did not work out with me. They help with certain things, but they also cause problems in other areas. The vaginal ring, also known as the NuvaRing, is a flexible, clear ring that is inserted through your vagina. It is 91% effective. It works exactly like the pill, but the only difference is it needs to be changed monthly. Personally, the NuvaRing is a contraceptive that works better for me than the pill. I don't have any side effects, and it actually gets the job done. The last form of the contraceptive that I will be talking about is the Depo shot. This is a method with a shot that can be given by a doctor or done at home. It is 94% effective, and it also lasts 3 months. There has been a lot of backlash and negative feedback about the Depo shot. A lot of people say that once they are done with the Depo shot, they feel a lot better than they did before while they were on their shot. They say that once they've gotten off the shot, their body feels more clean and more rejuvenated. In conclusion, I would like to say that birth control is looked at as a negative thing through a lot of people, but it also can help you for a specific time in your life. I know people that have said that they feel completely better off of birth control than they do while they're on it. They say that their body feels completely cleansed and more healthier while they are not on any form of contraceptive, not including abstinence or a condom. Birth control really just depends on your body and how your body will react to it. Your body will reject anything that they feel that it feels it is not healthy for them. So you have to talk to your doctor and consult with them to see what birth control method may be the best for you.